Welcome, welcome, welcome. I'm still Dr. Arnold Nerenberg. Been licensed as a clinical psychologist since 1974, and I've been licensed to walk upon this earth since 1941. So it's been my pleasure and my privilege to be here walking on this earth for over 81 years and to bring to you the lessons and inspirations of a lifetime with the intention of uplifting you for all the days of your lives. That's my intention. It's a very unusual title today. As I call it, productive insomnia. Productive insomnia. It almost sounds like a oxymoron. I mean, you think of productive one way, insomnia another. So how could you have productive insomnia? We all know we need that sleep, and we do. But sometimes we're not sleeping. And when people are not sleeping, not only, they may already be anxious, that may be part of the cause, may be depressed, may be part of the cause, may be in physical pain, may have thyroid problems. It could be many causes. But people can't sleep. A lot of times people get upset that they're not sleeping. Oh my God, I got to get up early for work. I've got to prepare for an exam, on a nursing program, whatever. I need my sleep. And so that person gets more upset about not sleeping. So it's bad enough the person's not sleeping, then they're upset about not sleeping. And that's what I'm getting at through productive insomnia. And I'll tell you some interesting ideas about it, and then some natural approaches that can be used. Now let me tell you the ways that your insomnia, when you can't sleep, can be productive. Number one, your night vision is in the rhodopsin and the rods inside. You have two types of receptors, rods and cones in the eyes. Well, the rods regenerate rhodopsin, and it does that when your eyes are closed, you get dark adapted. And so when you're sleeping, you're regenerating parts of your visual instruments, your rods. So you're regenerating the rhodopsin. So, and that's whether you fall asleep or not, just that you're lying there with your eyes closed. Good for your eyes. Then if you've been looking at a screen all day, you have that eye strain, just closing the eyes is healing. Now, when you're standing up or even sitting up, your heart is working much more rapidly than when you're lying down. In other words, your heart never stops until we're deceased, but it beats less frequently. It gets a little bit more of a rest between beats when we're horizontal, or even more than sitting up or standing up. So your heart is resting. You're not sleeping. You're having an insomnia for whatever the reason. I've named a few of them. Could be anxiety, depression. You have to keep getting up to go to the bathroom. You're coming back. You're not falling asleep. Whatever it is, there's so many different causes. But your heart is getting a rest. That's productive. Now also your spine, when you're sitting up, you're walking, you're standing up, that's a lot of pressure on the spine. You're laying down, you're resting your spine. So it's good for spine health, eye health, and heart health. Also the brain has a chance to regenerate, process. If you're sleeping is great with REM sleep, but we're talking about when you're not sleeping. Again, the topic is productive insomnia, because I don't want you to get more anxious about not sleeping. Now, I'm going to use myself as a case study. There was a period, I'm going to show you now you can even be really even more productive. There was a period when I wasn't sleeping. And so what I did was you could listen to videos, podcasts, whatever. It's good if you're just listening, not watching, because watching will keep you up. Well, while I was watching, I was watching the Chinese masters on Qigong. And I learned Chinese medicine, the approach of Qigong, to the Chinese masters during my period of insomnia. And I still was able to function during the day. I mean, I wasn't up all night, but the part, I think I probably made it a little bit worse because I was so fascinated by it. I would stay up just because of interest. So I've been doing Qigong now for 4 years, learning from the great Chinese masters. So you could be learning during this time. Again, it's better if you're just closing your eyes and you're listening. But I have a lot of videos. My patients listen to those every week. But there's so much material available for you to listen to and benefit from. Some people like to listen to nature sounds, winds or ocean sounds or birds, just to get a more tranquil state of being. So the lying down in itself is productive. So I don't want you to think, oh, I'm not sleeping. This is really a problem. Of course, it's great if we do sleep, get that REM sleep, or you're going into dreaming and whatnot. That's great. But sometimes that's just not happening. So I want you to know it's very productive. It's just that you're lying down. Yeah. Now, a lot of times people are not sleeping because of their anxiety's high, or they've got things on their mind. They've got to take care of this and that. I'm worried about this, worried about an exam, worried about I've got to get to the doctor's appointment. I've got a busy day tomorrow, and they're reviewing all the things they have to do. Well, one way of dealing with it, you have a pen and paper by your bed, and you just write down the list, all the thoughts that keep coming in your mind. You write them down. I got to do this, I got to do that. And when you write it down, often that will help relieve the stress about it, because you're not trying to remind yourself what I have to do, because you know you wrote it down. You don't have to remember it here because you know it's written here. So the list, in fact, you might even want to leave a pen and paper and a flashlight. If you're, so you don't wake your partner up, your spouse, you just take it, put the flashlight on there. Or if you don't have somebody you're sleeping with you, then you just put the light on and write down. Although the full light is more disruptive to a sleep state, so the flashlight's a little less disruptive for yourself. Then you write down your list, and that's going to help a lot. Now, there's two parts to the autonomic nervous system. There's two parts to the nervous system, the autonomic nervous system and the central nervous system. The central nervous system controls voluntary activity. Like when I'm moving my arms right now, that's from my central nervous system. That's under voluntary control. Then you have the autonomic nervous system. That's not as readily under direct control. It regulates breathing, heartbeat, digestive functions, and so forth. So the autonomic nervous system is divided into two branches. Parasympathetic, which is rest, digest, sexual or vegetative functions, versus the sympathetic, which fight, flight, and anxiety. So I'm going to show you a method that will activate your parasympathetic nervous system, which will then suppress the sympathetic nervous system. So you want to be able to cut down that activity of your sympathetic nervous system, which is keeping your anxiety up. So this will help promote a sleep state. But you want to be doing this, if you're very anxious, you want to do this 4 times an hour. You don't want to just wait till you try to go to sleep. You want to cut down that neural activity all day long by doing it 4 times an hour. And then when you're in bed, you can do some of the deep breathing. You might want to do one after the other. I'm going to describe how it works. So I'm going to inhale through my nostrils. I'll demonstrate it. Hold it for just a couple of seconds, and then I'm going to go. And when I go, we'll see my lips pursed like that, means I'm exhaling. And then at the end of it, I'll say, I'll be fine and I'm grateful. So watch how I do this, and this will activate the parasympathetic nervous system, which will suppress your sympathetic nervous system, which is fight, flight, and anxiety. Here we go. I'll be fine and I'm grateful. I've taught that method to many people. If you notice, my voice is even a little different. It just calms everything down. I can hear it in my own voice right now. It's much lower. So you want to do it 4 times an hour just so you're calming your sympathetic nervous system down. And then when you're lying in bed, you can do that and just lower that activity. So for many people, it's the anxiety that's keeping them awake. That'll cut it way, way down. Now, a person may have, you have anxiety and depression, that can be underlying causes, and pain. Their physical pain can be pretty hard, that can be pretty difficult. You might need some pain medication, allopathic or natural. Now I'm going to talk to you about a major threat that'll cause insomnia, but also can cause a stroke, and it's called sleep apnea. It's often associated when we're overweight. So I'm going to demonstrate what sleep apnea looks like. It's dangerous, and it'll wake you up. In fact, it'll wake you up with a panic attack. You wake up very disoriented and panicked. I have many patients that experience this, and I demonstrate this is what it looks like. And then they need a sleep study if this is something that looks like something you might have, particularly if you snore. One sign that you might have sleep apnea is if you're snoring. If you're overweight, you're snoring, you can ask your partner whether it's basically holding your breath when you're sleeping. Let me demonstrate it to you. You wake up very jolted, you're holding your breath. I used to have it when I had a lot of weight on me. I had that, I would hold my breath up to a minute. So the way you get a definitive answer to that is you have a sleep study, and you'll see how much, if you're holding your breath that way. There's a blockage in the back in the esophagus there. But then you get a CPAP machine, and it just forces the air down into your trachea and down into your lungs. Very effective, the CPAP machine. But when you lose the weight, I cured it by just taking the weight off. For most people, losing weight will cure that. So that's something that can cause insomnia, waking up with the sweats, night sweats, and panic attacks, and is dangerous. It can cause a stroke. So again, you go to a sleep study, you talk to your doctor, you get you get the CPAP machine. Now, as I said at the beginning, I'm a licensed clinical psychologist. I'm not an MD, so all the rest of the material I'm going to tell you, I legally have to just tell you, consult your doctor about it, if you so wish. Now, when you're lying there also, and you're doing your breathing, we have the whole honor system. You could be repeating your commandments of honor. If you pray, you could be praying. If you memorize something, you could be reciting. There's some things I've memorized that a lot of times when I'm recalling it, put me out to sleep actually doing it. But now I'm going to show you some natural supplements that will put you to sleep. One is melatonin. Now, the pineal gland next to your brain right here produces melatonin, but sometimes as we age, we're not making enough, or even when we're younger, we may not be making enough. So you can take melatonin as a supplement. It's over the counter. You can get it at any drugstore. I like the Life Extension products, so I get theirs. A good starting point is 3 milligrams. 3 milligrams. The side effect of melatonin is that it helps prevent various cancers, and particularly the time-released one will help regulate nocturnal blood pressure. So they're very healthy for you. You start with 3 milligrams an hour before bed, but you don't want to take it every day. You want to take it every other day. Every other day. Because you don't want to make your own pineal gland lazy. So if you got too dependent on it, your own gland won't be making it. So if you do it every other day, you'll be getting that benefit, the health benefits and the sleep benefits. So I'm going to show you, here's a good one. This is only 300 micrograms. That's like it's 1,000 micrograms in a milligram, but I recommend you take 3 milligrams and then you take the time release one on top of that. Because people find that when they take the melatonin, puts them out, but then they wake up later. Insomnia has 3 components. Delayed sleep onset, person has trouble falling asleep. Then, but other people, you might have 1, 2, or all 3 of these. And then the other part of insomnia is you fall asleep, but then you're waking up and you can't fall back to sleep, or you wake up 2, 3 times a night, and each time you're up for a half hour or whatever. That's another dimension. The other is called early awakening. You know, you don't really need to get up till 7, but you're waking up at 5. Usually that's related to depression, but not always. So the good thing about the time release, you can take it a few times. If you wake up in the middle of the night, you take the time release again. It goes for 6 hours. This one is, that's a 6-hour time released dosage. And again, I like the brand Life Extension. So that way you take the 3 milligrams and you take that, the time release, that way you're getting, and if you wake up, just pop another one. You can go up to even 60 milligrams. I mean, it's well tolerated, safe. Now, if you take too much of it, some people wake up pretty groggy. When I've taken too much, I've woken up pretty groggy. I didn't like that. But mostly the side effect is, and some people find some weird dreams on it. It's very dosage dependent. The more weight you have on you, the bigger the dosage you need. But if you're waking up groggy, then it means you got to cut your dosage back a little bit. So you got to play with it a little bit. Again, not every night, every other night. Now, magnesium can help calm you down. It also will increase your blood supply to your brain and your heart, and also has a relaxing effect. And by the way, if ever a person, God forbid, has a heart attack, it reduces the damage to the heart during a heart attack. So they have this one from Life Extension. This is magnesium acetyltaurinate. So a lot of different types of magnesium. This one is helps promote, calm you down. So if being stressed out is keeping you up, this is a good one to have. Another natural supplement called theanine. This also will reduce your stress, which then indirectly will promote sleep. Theanine, L-theanine. Again, Life Extension has them. Now, an amino acid that will help reduce anxiety. Again, whatever reduces anxiety is going to help you sleep if that's what's keeping you up. So there's GABA, G-A-B-A, all caps. It stands for a much longer name, GABA. Now, a lot of people over the holidays when eating a lot of turkey get sleepy from that turkey. And that's because of L-tryptophan. L-tryptophan, a natural amino acid. So you can take L-tryptophan. You can take the whole thing. You can take, if one doesn't work, you take a couple. You can be experimenting with it. You work through different pathways. L-tryptophan. Now, then there's a probiotic. This one has saffron in it. It helps with stress, enhances the mental outlook. It was a particular type of probiotic from Life Extension called Mood Improve. Mood Improve. There are a lot of prescription medications you can take. Generally speaking, they should be gone to as a last resort. These are all natural. It's not going to be as damaging as many of the medications are. Then, for magnesium, at night to just also calm your system down, 500 milligrams. Also, if you get angina, if you have some blood pressure things, you get angina over the heart, this will help reduce that because it dilates the blood vessels. This is magnesium, 500 milligrams. And then potassium also can help with that blood pressure and cardiovascular issues. This is potassium with extended magnesium. And this is extended magnesium release. So these are all 6-hour releases. And so you have straight magnesium, extended release, potassium, and magnesium extended release, and just a good dosage of magnesium. There's a process called deep muscle relaxation. So deep muscle relaxation is where you're tensing and relaxing the muscles. So right now, in fact, you can do it with me right now. Tense up your shoulders, study the tension in your shoulder area, hold it, pay attention to your shoulders, relax your shoulders. Okay. Stretch out your fingers, feel those fingers stretching, hold it, and relax your fingers. Tense up your arms, hold your arms, relax your arms. A lot of people carry tension in the jaw. Relax your jaw, relax your tongue. Relax your face. Feel your back relaxing, chest area, abdominal area, legs, the whole body relaxing. Feel your fingers relaxing. And just feel yourself breathing, the inhalation and the exhalation. Feel everything relaxing throughout your body. Okay. Inhale. Okay, take a deep breath. And open your eyes. So that's the process of deep muscle relaxation. Doing that when you're going to bed. It's good to even do during the day. It's just relaxing. But you can get you more sleepy. So these are some of the natural ways. Again, very often there are physiological, deeper psychological reasons promoting this, but these are some ways to address it without going into too deeply into the one, but some ways that could work. Because the symptom, very often insomnia is a symptom of many other problems, but sometimes the symptom is very dangerous and you have to address the symptom, like blood pressure. It could be caused by kidney problems. It could be caused by plaque buildup in the arteries. It could be many causes. But whatever it is, the symptom of hypertension is dangerous in terms of heart attacks, causing rupture of plaque in the arteries, strokes, so damaging the kidneys. So we take hypertensive medications, natural and allopathic medicines, because the symptom is dangerous. So without even getting to the root cause, sometimes we have to treat the symptom. We're saying with insomnia, it's a symptom often of other issues, but sometimes you have to just treat the symptom because the symptom itself could be a problem, serious problem. Well, this is my presentation to you on the term that I coined called productive insomnia. So I gave you some of the benefits of just lying there in terms of regenerating a rhodopsin in your eyes for night vision, resting your eyes, your spine, your heart, many benefits from lying there. And then also use that time for learning, listen to podcasts or videos, and then gave you some natural ways of dealing with it. The simplest and easiest being the breathing method, where you're calming down the sympathetic nervous system. So now I'm going to open it up for discussion. Jay, is there anything you want to say about productive insomnia?
Well, I'm very glad that you had this topic because I've been suffering from insomnia recently, or actually probably the last couple of months. So I've been using the melatonin and it has been helping.
Good.
As you suggest, I started off with a small 3 to 6 milligrams and gradually working up a little bit, but it does seem to be helping.
Helps a lot of people. Helps a lot of people.
Well, the breathing just calms me in general, so that also helps also.
These are all helpful. Yeah, these are all, you're not going to, there's no negative side effect of the breathing. The melatonin is well established for preventing different cancers, and the time release helps regulating nocturnal blood pressure. Nurse Kimberly.
We want to do it as
what's that?
We want to do it as natural as we can.
We're going to start with
any medication.
exactly.
To do that. Yeah.
start as natural as we can go. Absolutely. And then, of course, exercising during the day, that can help promote sleep at night as well. It takes out the stress out of the body, out of the muscles, reduces anxiety and depression. Working out will reduce, it's empirically been determined. Well, anybody that worked out knows this, but it's been also backed up by evidence-based research that will reduce anxiety and depression, and in which case, indirectly, then also reduce your insomnia. Nurse Kimberly, any thoughts about this?
No, just that I've been doing everything you've been telling me to do. I'm actually sick. I'm taking 6 milligrams of melatonin. So that's helping me when I take it. The days that I do not, if for whatever reason it doesn't help me, but I think I'm going to have to do that, like the tense and just kind of relax my shoulders, my fingers, my jaw, all that stuff.
And then the deep breathing, and the deep breathing to activate the parasympathetic nervous system.
Yes, absolutely.
Good. So you're up to 6 milligrams. Yeah,
yes.
You don't have to be afraid. I want to just say again for everybody, you don't have to be afraid of the dosage. You can go up to even 60 milligrams, and you don't have to worry about that. Stacy, any comments or questions you have on what's been said?
No, I'm so happy that you did a lecture on this because I have horrible insomnia. Pretty sure I'm sleep apnea based on what you showed and described. I started snoring the last couple years. I'm up every couple hours, and I definitely am productive at night. Like I get my best work done, in the middle of the night, but I can't shut it off, and so just doing these exercises right now with you, I actually yawned after I opened my eyes.
Yes.
Oh my gosh, really? It's like there's a yawn.
You can get some good ideas. And the other way, I'm just trying to cut down getting stressed over not sleeping. That's really why I coined the term productive insomnia. I just don't want you to be stressed. I'm not sleeping. Oh, God, I just want to sleep. I don't want you to do that to yourself. That's really the concept behind this. It's already bad enough you're stressed, you're not sleeping, and then I want you to get stressed about not sleeping. So this is meant to cut that one component down. Let's see. Lydia, any thoughts or comments from yourself?
I don't have anything to add, actually.
Okay.
But I did find that breathing slowly and from my lower abdomen actually really helped me.
Yeah, abdominal breathing is ideal when you can breathe from, abdominal where your belly's coming out instead of chest breathing. That's really the best form of deep breathing. Mm-hmm. Right. David, any comments or questions?
Well, I'm glad you brought up that sleep apnea. I'm going to get that checked out definitely because I do snore at night, I've been told. So I didn't realize how, how many problems that could cause.
Do you wake up in the middle of the night gasping for air?
Not all the time, but I have.
You have? Yeah, that's something to rule out because that's nothing to take lightly.
Right.
Yeah.
And I like all those natural supplements you mentioned.
Fernando, is there anything you want to add or question?
Yeah, hi. I've been up for 3 days already.
Oh my God.
Yeah, it's bad.
Yeah, up for 3 days is serious.
I'll probably end up going to the doctor tomorrow.
Yeah, you might need, a more robust intervention. Yeah, 3 days. Yeah, you might need a very robust intervention.
Yeah, it's bad right now.
Sometimes you just need the medication.
Yeah, I think I'm gonna need something like that. I'm going through some pretty bad stuff, so I'm sure it'll go away.
Yeah, we've all gone through things where it could be an interpersonal problem, a financial problem, and people are worried, and sometimes we need just really some extra help to go out. Sometimes people can't even lie there; they're too anxious to have to get up and go outside, walk around, and get fresh air. So I mean, sometimes you just have to do that.
Well, I have about 5 different things that I can do that help me sleep. One of them is actually that flex and relaxation thing you were talking about, that one of my athletic coaches taught us all as a team. If we have trouble sleeping, we start with our toes, start from the bottom, and work our way up our body to push the blood to our heart. So we curl our toes really hard and then relax, and then take a deep breath in between every flex, and then move to our calves. And then at the very end, once we work our way all the way up, we do our face, and we make like a really ugly face to flex every muscle in there. And
Yes.
then at the very end, we do everything. We flex everything all at the same time.
Yes.
And breathe and to relax.
Good process.
Another thing is that breathing method that you were talking about, which is also something I learned from athletic coaches. In order to do a quicker recovery during sports, to slow down the heart rate and to relax. So
Lowers blood pressure and lowers the heart rate, both. Absolutely.
right. And so we would just kind of take a deep breath, hold it for about 3 seconds, and then exhale slowly, and you can actually feel your heart rate dropping, just so you can relax a little bit, so you don't become so tense, and that way you can perform better in your sport. Another thing is I try not to have coffee after 3 p.m. because I'll have it latest maybe 2:45, and even that's pushing it. But having coffee after 3 p.m., it really disrupts my sleep cycle in the night.
Caffeine, absolutely.
One other thing that I do is I either sleep with the phone completely out of the room, or above my head or below my head, not at head level, because I really believe in
EMFs, the whole thing,
the technological rays
Yeah.
flowing through the air, and I
Yeah.
really believe that it affects your patterns.
Could
The last
do
thing
that.
that I do, if I really can't sleep, I'll close my eyes and I'll pray, but I'll pray out loud until I can't even talk anymore. Of course, the lights will be off, my eyes will be closed, and I'll be whispering. So it's like it's almost like meditative, and until I can, and then I'm just praying in my head, and then I just fall asleep in prayer.
Yeah.
So those are a few things that help me.
I memorize a really long prayer, and when I do it, I never make it all the way through. Yeah, it puts me out. Very good. Thank you. Thank you. Thank you, everybody, for being here. It's been my pleasure to be here with you. My pleasure to present Productive Insomnia.